The most common symptoms that you will feel with relation to heart attack would be chest pressure, and it's usually central, and it's accompanied with feeling very poorly in general. The pressure is usually the worst that they could have ever felt, and it could radiate up into their neck, or it can radiate out into the shoulders or the arms. If it's a big heart attack, it can, and if a significant amount of the heart muscle is at risk, they can sometimes develop quite significant breathing difficulties, as well as very acute congestive heart failure. So they could have difficulties sitting upright, or they could have difficulties laying down, or they cannot breathe, and they feel their heart race. They could feel fatigued, tired, weak, lightheaded.
Can you have a heart attack and not even know?
And that is also a common thing. This is more frequently found in patients who have diabetes. When you have diabetes that is poorly controlled, the constantly elevated sugar levels in your blood damage the fine nerve endings in your body. So not only do they damage your eyes and your kidneys, but it could also affect your nerve endings to your heart. And so you could be having a heart attack and not feel anything. But you could feel the consequences of that heart attack, which is again breathing difficulties, or feeling nauseous, sweat and feeling chilled, having abnormal heart rhythms. If you are a female, it is more common to have the less common symptoms of heart attacks, right?
So it's more common to have the less common symptoms. Okay.
That is a Khooism. Okay? Because those studies were again conducted mostly in men last century, we understand what women experience less. So in women, they may feel just a general anxiety, or they could have a headache, or they could feel indigestion. Men could also feel indigestion. But when the woman is not feeling right, I think the key here is to represent themselves well in the emergency room, and not take it just as it's all in your head. As recently as last year, I have encountered women who have lost a significant amount of heart muscle as a result of misdiagnosis of an actual heart attack. And that's too costly for them, and it's not well deserved.